It's Midday Buzz. I am the Green Man with you all the way till 3 this afternoon. Chenta is here with me this morning, and we welcome together our guest in the studios, Dr. Nadia Azli Sham. Welcome, Doctor. Nice to have you.
Thank you. Thanks for having me.
Lovely, lovely, lovely day. And you're dressed up in beautiful blue and stuff. Is that a color that makes people feel comfortable, apparently?
Yes.
Right?
It's like this color.
Right?
Yeah.
So it's like, when the patient sees it, it feels soothing and
True.
and relaxed and stuff like that.
Yes.
What would happen if the patient sees a face like mine?
Yeah. They will try to smile. If not, they will just cry.
They'll just cry.
But once you cuddle them,
Right.
they'll be okay.
Oh, lovely.
That's a secret.
That's a secret to
Cuddle
that,
them.
isn't it? Okay. All right. So you're a consultant pediatrician at the UITM Private Specialist Center. What's it like working over there?
Oh, it's nice. It's actually a new place for me.
Right.
But I like the environment, the workplace there. It's very comfy, and we want to expand in UITM Private Specialist Center, especially in our pediatric department.
Right. Did you grow up always wanting to be a doctor?
I think from the early years, not so, but I was encouraged by my parents.
Right.
Yes, and then I think back in olden days, you just follow what your parents told you to do so.
Right.
Then along the way, then I developed the interest. Okay, then when I started my undergrad, I did my undergrad in University Malaysia Sabah for 5 years. So from there on, then I noticed, okay, this is my path.
Right. So what do you say to kids today who are deciding, maybe at that crossroads, not sure about whether they want to pursue a career in becoming a doctor or something like that? What would you say to them?
Be true to yourself, know what you want, and discuss with your parents.
Correct.
They will lead you.
Correct. And the parents always want the best for you, right? As much as we think the parents, my parents are so boring, they
Nagging
disturb
me.
nagging and stuff like that. But, I think kids got to understand that your parents just want the best for you.
True.
And it's good to go along with it. Along the way, if you can prove to them you can do it, you can also prove to them that you can do something else.
True.
And
it's not always one job. You can do other things as well at the
right?
same time.
You never know, yeah?
You're multi-talented, you never know.
Correct. But
Once
give them
you
the
go
benefit.
out of your box.
Yes, that's true. So give them benefit of the doubt first,
True.
yeah, ma'am?
True.
Okay. All right. Doctor, let's start with the big picture. How serious is dengue right now in Malaysia, especially for children?
Okay. Dengue, as everyone knows, dengue fever, dengue infection is something everyone talks about. And I think most of us at least have had one dengue infection before. Maybe among our family members or your neighbors. Okay. And I think in Malaysia, we don't have the recent data, but back in 2023, nationwide, the dengue reported cases is about 123,000 plus. Okay, and then children, if you see, not in Malaysia specific, but the Asian study confirms that the highest risk to develop severe dengue infection is among children who age less than 1 year old.
Ouch.
And between 4 to 9 years old.
Right.
The one we want to prevent is a severe dengue infection that ends up in ICU.
And they're so young, they can't even tell you that they have dengue, right?
Yeah.
So, how are you going to know that they're actually having dengue?
Yes, that's why everyone must be alert and aware of the symptoms of dengue, from the mild symptoms up to the warning sign symptoms. So the mild symptoms usually it started off with fever. It can range from 38 to 40 degree. Some can even have fit, seizure.
Fever fits. Those are dangerous. Yeah.
Yes. So from the mild symptoms, from fever to reduce oral intake. Okay. And then complain of headache or pain.
Yeah. But if they're so young, they can't tell you, right?
They just show. If like 1 or 2 years old, they can talk. They can say pain here.
Right.
Pain
so they'll
here.
point to which part.
Yeah, they can point your joint, your muscles, your eyes. Okay, but then if smaller, less than 1 year old, they will just cry.
Yeah.
Cry, less feeding, and fever.
Right.
Something is not right, but they cannot tell. So parents need to be aware and bring to doctor to see.
Right.
And for the warning sign symptoms, the one that you really need to pay attention, severe abdominal pain, persistent vomiting, very lethargic, always sleep throughout the day, sleep and very reduce oral intake until it looks very lethargic. And the last is if have bleeding.
Oh.
If bleeding from the mouth or bleeding from your when you pass motion, it bleeds from there as well.
Right. Okay. So is it quite common to see people who are always like coming in too late?
Yes, actually, for children, specific for pediatric population, those bigger children always come late presentation, because parents have tendency to observe first. It's okay, just day 1 of fever. It's okay, just day 2 of fever. He will recover at day 3. They are big children. They are already 10, 11 years old. It's okay. They can just take Panadol and rest at home and don't go to school. But the symptoms get deteriorate faster because pediatric bodies, they are relatively smaller bodies, so they have less reserve. So they deteriorate very fast. So when the teenage, 10, 11 years old, they come late because of the lack of awareness, because they can compensate that they are sick. They can rest first. But once they come to hospital, they are very bad condition.
What's a common misconception in methods of healing? Like, parents might think like, okay, go and have this papaya or something or whatever.
Oh, yeah.
I don't know, but what's a common misconception that they're doing, and then you find out that it doesn't work, and then, you just wasted time?
True. I've heard papaya leaf, crab soup.
Crab soup.
Yes, papaya leaf, crab soup, it can heal dengue. Okay, but then what is that is just a supportive from alternative medicine. Something is not proven. But I think the most misconception is just a mild fever that will go off by itself. It starts from there. Misconception of it's just a mild illness. It's not good. When you have kids, no matter whether they are small or big, school-going age, whenever they are sick, please pay attention.
Right.
If they tell you, I'm not well today, I cannot go to school, I'm very tired, that's the point that you must bring to see doctor.
Okay. Don't take it as my kid's trying to skip school or something. A lot of times it's like, yeah, this one just trying to pull a fast one. So what's a good thing to keep at home as a parent? If you have young kids and all that, what are good thermometers?
Definitely, you must have an accurate functioning thermometer. I've seen parents came to see me and they show me their thermometers. I'm not sure about the brand, but it's not functioning. Because when I tested with my thermometer, it gives a different reading.
Right.
It's actually the child, for example, the child felt warm, and my temperature showed is 39. But when the parents showed me their temperature, it's about 36.8. So you must make sure your thermometer accurate, functioning, and for kids, you can use the infrared forehead or at the axilla.
Right. So dangerous, right? They might be buying these things online.
True.
And they're getting it from the wrong sources.
Yes.
And
when it's not functioning well, they believe the thermometer 36.8 rather than actually the child already having high fever, felt warm. So they waited at home.
Right. So, okay, please listen to that. Yeah, folks, we've got our doctor in the studios this morning. Dr. Nadia is talking to us this morning about dengue vaccine. See, that's what happens when I got fever when I was young, huh? And they didn't send me for... Okay, now we're talking about the dengue vaccine, yeah?
Okay.
So what exactly is the dengue vaccine and why was it developed?
Okay, dengue vaccine. Okay. The name vaccine means prevention. The dengue vaccine means it gives a good protection, a strong layer against the virus infection. Okay, the one that is main vaccine developed for children. Now, today we are talking about Q-Dengue. Okay, the name is Q-Dengue for dengue vaccine. It gives good protection, safety data to be given to children as young as 4 years old. And then it can give immunity protection against the dengue infection up to 4 years from the recent clinical data. Okay, there are still ongoing research to see whether is there a need of another booster after 4 years in the future.
Right. This wasn't available before, yeah?
Yes, and then the vaccine, when it says give protection means prevention, means the vaccine reduces the severity, the symptoms of dengue, especially the severe cases that ends up in ICU, and prevent hospitalization. Means if a child gets vaccinated with dengue vaccine, when the child has dengue, the illness is much milder and doesn't require any hospitalization.
Nice. Is there a chance that some doctors who have not been updated?
Yes. I feel there are many people, even among doctors, are not aware of this dengue vaccine available for children as young as 4 years old. And this dengue vaccine, Qdenga, has completed their large phase trials in the last decade. But it was first approved in Malaysia 2023 and available in market 2024, readily available in private sector.
Right.
Yes.
So the best places to go to actually get this
Yes.
would be
Private clinics or private hospitals, like my place, UITM Private Specialist Center. We will give this. It is 2-dose schedule vaccine, 3 months apart.
okay. Right.
Yes.
All right. So we've got more questions about that coming in. Yeah.
So far, it's not yet in our national immunization program.
It's not yet. Yeah.
Not yet, but there are ongoing discussions to bring in to get a wider access in future.
Correct. That's good, isn't it? Yeah.
Yes.
And which dengue vaccines are available? You mentioned some already.
Qdenga.
Qdenga. Are they safe for children? Definitely.
Safe for children, very mild side effect, which is mild and short lasting. Just
Right.
mild fever and soreness at the local injection site.
Right.
There are no serious side effects reported so far from this Qdenga.
Right. When you get a vaccine, it's expected, isn't it, to have a small little.
Definitely, we will usually, me as pediatrician, we will always, every time we give vaccine, we will tell the parents, okay, vaccine has mild side effect, can have fever with mild redness over the injection site, but no need to worry, just monitor at home.
Right. And then it goes off later on.
Yes, it's short lasting.
And once it goes off, it makes you stronger, isn't it? Because your body has now developed that
Yes.
immunity.
Yes, this vaccine you must complete 2 doses
You must complete 2 doses.
to get the maximum benefit of the protection.
Right. How many months apart again? 3
3
months?
months.
3 months apart. Within that 3 months, you must get the second shot as well, yeah?
Yes.
It's important. All right. Okay. And how effective is the vaccine? Does it prevent dengue completely?
Okay, the vaccine, all vaccines are not 100%.
Okay.
Protection.
Yeah, we were told we had a lot of practice
Yes.
with vaccines.
But this dengue vaccine have a safety clinic. It shows significantly reduced symptoms of dengue, especially in severe cases in children.
Right.
Okay, and it gives protection up to 4 years before you need to get 4 years. And as for now, there are ongoing research to get a booster in the future.
We get a booster in the future, yeah? And how's the vaccine given?
The vaccine is given through injection.
Injection,
To
huh?
your
You can't get that scrape thing.
No.
No. Once upon a time, they did the scrape thing, right?
Yeah.
It's no more given.
No more.
We used to have you had that. Chenta. You never had. You always got jabbed.
Yeah.
Your doctor was sadistic. Yeah. Yeah. Okay. All right. So does it protect against?
Even you are vaccinated, you still can get dengue infection.
Right.
But the illness, the symptoms is much milder.
Okay. At what age can a kid a child get vaccinated in Malaysia?
For dengue vaccine, 4 years and above.
4 years and above. Yeah. And does a child need a blood test before taking the
Okay,
vaccine?
for now, okay, this is a very special about Qdenga. You don't need a blood test. You don't need to do a blood test prior to get the vaccination. Unlike the older version of dengue vaccine, there's actually another older version of dengue vaccine. It's called DENGUE.
Okay.
That one needs a laboratory confirm positive dengue.
Or then.
Laboratory confirm previous history of dengue infection. Then only you can get that dengue vaccine, DENGUE, which can be given at older children age 6, if I'm mistaken, is 9 years and above.
Okay. But this new one is safer for relatively almost everyone, right?
Yes.
Are there kids who should not take the vaccine?
Okay, yes. There are certain kids that should not get the vaccine. Number 1, those below 4 years old. Number 2 is those having severe allergic history. And anything the child has allergic towards the vaccine component. That's why before vaccination can be carried out, parents must bring the child to see a doctor to check for the medical background before getting the first check.
All right. Who would you recommend? I mean, kids living in certain kind of areas or anything, or would you recommend everybody?
In Malaysia, we are considered endemic country for dengue. We have rising high burden of dengue in our country. Not only our country, if you can see dengue vaccine also been practiced in other countries like our neighbours, Thailand, Indonesia. Further up, Brazil, Argentina, European countries like UK, Portugal, Spain, they are also practicing dengue vaccine, this dengue, because they are also facing high burden of dengue infection in their countries.
Right.
For us, it's very important because we are endemic country for dengue.
Right. We're in a country that's prone to
Yes.
getting it. Yeah.
True.
And as
if
much
you
as
can if you can prevent the dengue infection, it will be very, very good because you can prevent the hospitalization, prevent the severe dengue case, and ultimately prevent the complication, which is the one we don't want to see, is the death.
yes. Okay. And then don't be misguided. Sometimes we think around our house is very clean. We take care of our house, but then you go to the mama, you go to outdoors, you have sports and all that happening, and I can't reach in time. I'm too blind. Where? What did it say? A question over there. Sorry, where is it? Both adult and children can take vaccine. I have 4 and an 8-year-old, so both eligible to get the shots. Is that the one?
Yes, definitely eligible.
Both eligible, yeah.
And
Sorry.
parents can take as well.
Parents can take as well, yeah?
Yes.
And would you encourage parents to actually go and get it?
Yes.
Yeah, especially if you have a history in your family and it's happened before, yeah?
True. And if you have experienced dengue fever, you wouldn't want the second dengue fever because the second dengue infection is more notorious, more dangerous compared to the first one.
Oh, ouch.
That's why we need the dengue vaccine, so we prevent the severity of the symptoms, prevent the dengue, the severe case.
Okay, and what about, you said like the vaccine is given injection, right? Is it a single shot? And how long does the protection last?
Okay. Single shot, yes. It's a 2-dose schedule. 2 dose means 2 doses, 3 months apart.
Okay,
But one single shot.
right.
For 2 doses, 3 months apart.
So do they need to repeat that after
It gives protection up to 4 years.
4 years?
This is for the recent clinical data, recent research that show about dengue, but there are still ongoing research to determine whether a booster is needed in the future. Means after 4 years, are you still protected against this dengue virus?
Right. Okay, doctor.
We will know from time to time whether we need the booster or not.
Correct. Okay, it says on the paper over here, break. Do I break, Chinta?
Yes.
Okay. Love Chinta. Good morning. We're talking to our doctor in the studios this morning. Dengue vaccine for children, and it's Health on TRAXX with Dr. Nadia Azli Sham, consultant pediatrician, UITM Private Specialist Center, UPSC, and she's here today. Is your gang listening in, doctor?
Thank you.
Do you have
Hello?
your gang? You have your gang listening?
Oh yeah, I have. I've asked around to watch and see.
Oh, nice.
This slot, and then I'm talking about dengue vaccine because I need to increase awareness of the availability of this dengue vaccine in Malaysia.
Right.
To prevent, to reduce the symptoms of dengue and also to prevent hospitalization.
Correct.
From dengue.
Better prevention, better than cure, for
True.
sure, isn't it?
True.
Okay, let's talk about the cost. Now, how does this vaccine typically cost in Malaysia? Is it covered by insurance also?
Depends. Certain insurance cover, certain doesn't. But the cost can range between 450 to 500 for two jabs. But I think it's worth rather than having the severe dengue end up in hospitalization or ICU.
Correct.
Yes.
Correct. Because that's going to cost a lot more after that, yeah?
Yes, definitely.
Okay. All right. How long will a kid how long does it take once you get dengue? How long does it take to heal?
To heal from the dengue infection. Okay, that dengue can range from mild to severe. If mild dengue, you will have about 72 hours. The infection will go down and you will start to recover. The moment you recover, the symptoms will dissipate. Means you will no longer have fever, your appetite has increased, you can drink better, your ache, your sores in your body will get better. And then in between, for the 3-4 days when you are having the infection, we will monitor the blood parameters to see your white cell count and to see your platelet. Because during the infection, white cell count and platelet both can lower. And if your platelet is very low, platelet is in the body is to clot. If your platelet is very low, like below 50, you have tendency to bleed, even when you are brushing your teeth.
Oh.
Or can have spontaneous bleed as well, if your platelet is very low. That during the infection, it can go low. The moment you recover after 72 hours, and then it will go slowly increase. But it needs to be monitored clinically. That's why I need to continue seeing doctor. Number 2, monitor from the blood parameters as well. So for dengue, it can last about, the recovery also will take about 2 days. So it can be about 5 days if for mild symptoms. That you can monitor at home. You just go to see doctor on daily basis at clinic. But those with severe symptoms or late presentation to hospital, I need to be admitted and monitor in the ward. If the severity gets worsened, the symptoms get worsened, means with vomiting, with signs of shock, means I need to be monitored closely in ICU. It will be much longer, the duration in hospital stay.
If you've gone through all that, do they automatically vaccinate you when you come out after that, or you have to go and get a vaccination after that?
Okay, after you recover from dengue,
Yeah.
when you are well, then you can get the dengue
When you're
vaccine.
well only.
Yes.
Right. So while you're recovering, no, you don't get it, yeah?
No.
It's only after you get better, yeah?
True.
Okay. So what should parents listening in right now who want to vaccinate their children, what should they do?
They should see doctor, pediatrician, and talk to your pediatrician. Tell your pediatrician that you are keen to get the dengue vaccine, and the doctor will check your child, and if everything is okay, then your child will get the first jab. Okay, and then the second will follow after 3 months.
Right.
And after that, from 2 doses, your child will get the maximum benefit of dengue protection against all these 4 virus strain of dengue. We call it DENVE 1, 2, 3, and 4. DENVE 2 is the notorious strain that caused the severe dengue. But this dengue vaccine covers 4 strains.
Right. And how fast after you get the vaccine? You know how people are, right?
Yeah.
They feel like, after I get the jab, I walk outside, I'm immune already. Right? So how soon?
Usually after you get vaccine, it takes about 2 weeks to be protected, to be immunized.
Right.
Okay, but then for maximum benefit, must complete the 2 doses.
Right. And doesn't mean you can keep, water containers outside your house and play around and hope that a mosquito bites you just for fun, yeah?
Yeah,
You still have to take all those measures.
Dengue vaccine is just part of prevention. But dengue vaccine plus mosquito control measures are very important. What are mosquito control measures? You must make sure there are no mosquito breeding sites at home.
Right.
No stagnant water.
Yeah.
Okay, you must ensure your children, when they play outside, outdoor, they wear mosquito repellent, long protective clothing. And mosquitoes, they go outside between 5 to 7 p.m. or 5 to 7 a.m. That's the time that they go outside and looking for victims.
My mother used to tell me that's the time the hantu will come out. So she come back home, don't play outside already. But I think maybe what she meant was mosquitoes would be coming for you at around that time, 5 to 7. And yeah, okay. So we talked about children. And if a child has already had dengue before, should they still get vaccinated? Yes. Some parents say, my child is healthy. Why should they need the dengue vaccine? What would you tell them?
I've seen dengue infection affect all children. From active, strong kids, they end up in ICU. So dengue can affect every children. So getting vaccination is very important.
Right.
Yes.
Yeah. What else do people need to know, doctor? I mean, a lot of times we think like,
Dengue is okay. Dengue
it happens to the other kids. It doesn't happen to our kids.
Dengue is not just a mild illness. It can range from mild to severe. Those that we want to prevent is the severe cases. And we don't know who will get the dengue infection.
Right.
Okay, so must be aware and alert on these dengue symptoms, from mild to severe, and get your child vaccinated.
Right.
If they are eligible.
What are the ones that frustrate you? I mean, I'm sure you've seen like cases where it's avoidable, but because of some stubborn parents, yeah, I'm sure you've seen. Yeah, I know you want to be nice and all that, but I'll say it, doctor. You know, got some stubborn ones, huh? Who just want to believe in their old ways or what the auntie says. No need lah. This old family tradition.
True. I think it covers about vaccine. If you can see why recently our Ministry of Health, they did the program in health clinic kesihatan. They give the MR booster dose to those children as young as 6 months up to below 5 years old. They give this MR booster vaccine because the rising case of MMR, rising case of measles, the infection that was once pupus,
right,
because of the vaccine, but because of many people did not vaccine, the measles re-emerge. That's why there's an additional dose now.
Right. There are like some movements of people who just don't believe in vaccinations, right?
True.
And how detrimental is that?
It's very bad. It's very bad when your child gets sick, and it's not a mild illness. Your child gets sick, very sick, until and in ICU, because these viruses, this infection, once they cause brain damage to your child, the damage will last forever.
It's irreversible.
Yes.
And wow.
And then when you know it is preventable.
Yeah.
Yes.
It's so silly, isn't it?
Yes.
Right. So what's happening with things about vaccine? Like if we had COVID again one more time, do you think we're going to get those numbers again of people who are actually, going to go out there and get vaccinated? Because there's a lot of things going on.
Yeah.
What is right? What is wrong right now? There's a lot of arguments that are going on. So what is your take on that?
Okay. COVID. Okay. Everyone was scared of COVID one time, but now it is quite norm. Oh, you had COVID infection. Now people are not as scared as before, because we had the vaccination. We had also the booster. Okay. But in years to come, there's always the strain will evolve. When the strain evolve, then the need of the further vaccine, further booster to cover the new strain of COVID, the new strain of any vaccine, the new strain of any viruses. This is just example of COVID. I feel if the COVID re-emerge and it has different strain with more severe symptoms, then it's good. Then another vaccine is a must to cover the new strain of COVID.
Right. I think there's a lot of misinformation,
yes,
and disinformation.
True.
and a lot of not enough of understanding of what's happening.
Some parents they took vaccine, let's say COVID, they took COVID vaccine for themselves, but when it comes to their children,
They don't want to.
yes, I have seen a lot. They say, then it's quite sedih, because they protect themselves, but they thought they are protecting their children for not giving the vaccine.
Right.
Yes.
What about that talk on the street, all right?
Yes.
Forgive me if I'm being naive, but, I just talk about what people are saying out there. And a lot of people say that, because of this person died because of that.
Or they meant by the side effect of the vaccine, is it? The side effect of the vaccine causing the person die from the vaccine.
This person was, perfectly healthy.
Okay.
And then after taking the vaccine, this happened, that happened, all that. There's a lot of belief of that in certain quarters.
True. Okay. I've heard that before. Actually, there are no proven data to confirm that, because a person, a healthy young man, can just collapse by the street, and you don't know the cause until you do a post-mortem. And actually, the man died from a heart block that has never been investigated, because that young man has never had any symptom before. So it's something unpredictable risk. So vaccine can reduce the unpredictable risk by giving another strong protection against the virus.
Which is what people don't realize, yeah?
Yes.
Instead, we take the negatives,
Yes.
and that's what they highlight. Okay.
True.
All right. So just to recap over here, vaccines for kids are available as soon as they reach what age? 4 years old?
4 years and above.
After 4 years old and above, and it's also available for adults. and you should get your kid vaccinated.
Safety.
Yeah.
It's safe for children.
It's safe for children. At which places again?
In private clinics, private hospitals, in UITM private specialist center, we have the vaccine.
Right. So you can just get in touch. Yeah. Are there phone numbers? Are there websites to actually
we
check
have-
out?
Yes, there's.
Yeah.
Yeah, there's a website.
Do you have the website? She's trying to look at your information, Chinta. She's okay. All right, Chinta is getting the information for me. All right, at UITM Private Specialist Center would be a good place to begin.
True.
First for you. Yeah, you can get in touch with them over there. And then, what else is important for us to remember, Doctor?
Vaccine prevention is better than treatment. Because prevention save costs and also save life.
Yeah. What about when they actually get dengue and they need treatment? Some people will say a traditional way, and they can do it with go and eat one whole papaya tree or something like that.
Get yourself checked whenever you even you have mild symptom like fever, headache or soreness. Please bring your child to see a doctor to have a thorough examination and also to get blood check from dengue.
How long will that check take?
It's actually very fast. Within few hours, you can get the result.
Okay, you can get the results
And
already.
need to the moment is positive. Monitoring is very important. If you mild dengue and doesn't require hospitalization, it means you still need to be monitored on daily basis. Means need to see doctor on daily basis to see your to check your symptoms and also your blood.
Right. If you wake up at 2:00 in the morning, your child is crying like crazy, right? Do you wait till the morning sun comes up and then go to the hospital, or should you go straight away?
Okay, every parents, please bring your child as soon as possible.
Straight away, yeah.
Straight away.
No sun or whatever it is. Don't wait, yeah.
Yes.
Just go straight away, yeah.
Yes.
Sometimes people think I can wait for the morning to come and then go for it, yeah.
It's very do not delay. And do not delay because if something bad happen, you will feel guilt.
Right.
Yes.
On the way that you're going, are there things you can do to comfort the person or the child?
Okay, so that's why you need thermometer at home, accurate and functioning. You need to have fever medicine. Whenever your child has fever, you can give one dose and you can bring to hospital.
What kind of fever medicine are we talking about?
Paracetamol.
Okay.
Paracetamol is safe for children based on their weight and age.
All right. Okay. What are the other ones that you have? The ones where you insert and all that?
Oh, the insert. Okay, because I think I've met many parents. They are actually scared to insert because they feel they cause pain to their baby or young child. So at least you have a ready stock of your fever medicine syrup to give. So
Right.
whenever you buy fever medicine, please inform the pharmacist your child's weight so that the pharmacy will give you the correct amount.
Right. And also check that your medicines are not what do you call it, past the date,
It's not expired.
Not expired, yeah. Don't be using expired products. Kids is like, oh, we kept this from grandma's time, It's red. It's not supposed to be red. Yeah. Okay. Oh wow, doctor, thank you so much. Is there anything else you'd like to add? Nothing. Tell your boss to buy you lunch.
Okay, you can. Oh, there's a website. Our hospital www.uitmpsc.com.my.
Okay.
Okay, you can get more information and get appointment from this website.
Right.
If you're interested to get dengue vaccine,
Correct.
not only for children.
For yourself.
Yes.
Yeah. Is there a phone number there? No phone number. Okay. All right. Wasted. I wanted doctor to do her DJ voice. She can choose the phone number for us. Okay.
Okay,
All right.
thank you.
Absolute pleasure having you, ma'am.
Thank you so much for having me.
And I hope you don't meet a lot of stubborn people. And yeah, because we patients, we can be stubborn, yeah, sometimes. And I don't know why it's so hard to get that through our thick skulls. And it does frustrate doctors, I'm sure, right, Chenta? See, Chenta is another one of those stubborn ones. Yeah, I bet you. All right, so yes, Dr. Nadia Azli Sham, consultant pediatrician, UITM Private Specialist Center, UPSC, in the studios of TRAXX FM. It's been an absolute pleasure. Thank you. I look forward to seeing you again.
Thank you.